Okay. Hello, hi all, and welcome back to another edition of Crisis Talk.
And today we're going to be talking about how come black people are dying at disproportionate rates in hospitals. But before we get too much into this, we just want to make a quick disclaimer that, of course, big thank you and big respect goes towards the NHS for the hard work they've done, not just during this crisis, but since the beginning of NHS. We love the NHS and we do not mean any slander to the NHS with what you're about to hear next.
My name's Palimi.
And yeah, I'm William, and as usual, grateful to be alive.
And I'm Shy, and today we have a guest as well.
Yep, and I'm Chris, medical student at Newcastle Uni.
Coming serious, we've brought an actual expert on this topic.
So
we're not
that's
just
going to be a
speaking
doctor. He's going to be a doctor. You're in second year, Chris. Are you going to third year? Or?
I'm in third year, going into fourth year in September.
His first rodeo, he's basically a doctor.
Literally. So I'm going to start off with this. Carly Williams was a 36-year-old woman, and she died from coronavirus symptoms. Her husband said that he was told that the hospital wouldn't take her as she was not a priority. And then, although it was found in documents that paramedics were treating it as a serious coronavirus case, Keela Williams was a black woman and she was a mother of 3 children. I feel like this is just one example of many cases in the NHS specifically in regards to the coronavirus of black people being treated in disparaging ways, and I wonder why that is. I feel like it's a very multi-layered issue, and I think on the surface level we can say we can all agree that there is some racism and institutionalized racism that is involved. But I think in this episode we're trying to look to dig deeper. So black people are 4 times more likely to die from coronavirus in the UK.
There's definitely lots of problems in terms of race and coronavirus, because it's something like 90% of the medical staff who have died treating coronavirus patients were also BAME. So
exactly.
So white people have got some explaining to do.
The first time we're ever in agreement, William. Let's see how long that lasts.
And Chris, being a medical student, how would you say you are taught when in regards to treating patients? Is it like, because I know you said it's quite white centric before we came on the call?
So I think that's one of the main issues actually, because the way in which our curriculum is set up, our governing body called the GMC, General Medical Council, they decide.
You're naming and shaming. Come through.
They decide what each year is going to be taught and they decide the curriculum basically. And so I feel like the curriculum is quite white centric in the sense that everything we learn is based upon white patients. We haven't learned anything in regards to if a person of color comes up with these symptoms, what do you think? It's more of a white person will come to you with this skin rash. What do you think it is? And obviously, I'm using skin rashes because they're the most obvious example. It's something that we can all see. So in all the textbooks I've read, it's always skin rashes on a white person, and that's fine until you come across a skin rash on a black person or another person of color, and that's when you have no idea. You literally would have no idea what it is because it just hasn't been taught to you. So I think that's where one of the major issues lie.
And that I'm just going off of your point, Chris. And I feel like because of how it's taught, when we talk specifically about doctors, there hasn't been enough studies to show that doctors treat people based on race or based on the fact that it's racism. And seeing that you are taught from a white person's perspective, I think when doctors do become doctors, when students do become doctors, they only know how to treat white patients, and they can only do what they know. So it's not. That's why I said before that it's multi-layered in the sense that when student doctors become doctors, because they can only do what they know, and the only things that they know in regards to a skin condition, for example, is a white person. they can only do that work. So then I wouldn't say that that was necessarily racist. I would say it was because of how they were taught. Because I feel like doctors, when there's a natural care that you would have for people.
I was just gonna say, yeah, I would say, yeah, it's not the individual's fault necessarily. As a medical student, obviously, it's not your fault that your curriculum, like, you know, all curriculums in the UK is ethnocentric. However, I think the issue primarily lies obviously with the institution. The institution is what is racist in this scenario, because they know that this problem exists. For example, like, but they often, I think it's like nobody wants to admit that they're racist, or nobody wants to admit that they have these biases or these problems in the system. But the thing is, we don't have time for pride. Like, there was a petition last year that I signed. Black women are 5 times more likely to die in childbirth compared to white women. There was a petition, we signed it, and the government got back, like, it was one of the ones where you get 25,000 signatures, it goes to Parliament, whatever. They got back, and I still have the email in my phone, and they were like, yeah, we think it's all about social problems like access to healthcare. Yeah, that is an issue, but there is also an issue in your system. Kalechi, if anyone knows Kalechi, there was a midwife that responded to her and said that in her classes, I don't know about other medical schools, they're still taught that black women have a higher pain tolerance. They're still taught that black people have thicker skin. So when a woman in labour is saying, I have a problem, something doesn't feel right, people aren't listening to them. You need to deal with your system. There's no time for pride. Black people are dying. Yeah.
Exactly, and a scientific study from 2016 shows that there also still exists a false belief that about biological differences between black people and white people, such as that black people's skin is thicker than white people's skin, or that black people are biologically stronger than white people, or that black people's blood circulates more quickly than white people's blood. So I feel like these false narratives still exists till this day, and 2016 was, even though it was 4 years ago, the fact that it's still so prevalent, I think that's an issue, and the fact that this study shows that, I don't understand why people are still getting taught that black people have higher pain tolerances, like, and even if they did,
it doesn't mean we don't need medical assistance.
To the point about black women dying in childbirth at 5 times the rate of white women are. You know, I agree with what Shai was saying. I want to quote Dr. Anna Langer, who's the director of Women and Health Initiative at the Harvard School of Public Health, and I think she put it brilliantly, because she said, basically, black women are undervalued. They're not monitored as carefully as white women are. When they do present with symptoms, they're often dismissed. And you see this a lot. For example, this happened with Serena Williams, who's like a really, really successful black tennis player. And basically, when she was giving birth, the day after she was giving birth, she had a pulmonary embolism, which is basically a blood clot in the lung. So air and blood can't like get in and out of the lungs as effectively. And so Serena Williams, like, she was saying that, she was like gasping for air. She realized that she was breathless, and it took her going to her nurse 3 or 4 times for them to actually do the appropriate tests and come to the appropriate diagnosis. So there is a case of some medical professionals dismissing like the opinions or what the actual patients are saying at times.
Yeah, that's a serious problem that like the actual institution itself is in individuals. I don't know. It kind of looks like they've put a priority on the health and safety of white lives than black lives, which is kind of weird. Because I was talking to my dad yesterday, in fact, who's a nurse. Obviously, right now nurses are very, very busy. But my dad doesn't work with NHS. He works independent. He's probably not going to be too happy about his business out here. But what he said to me was, if the supervisors and that ever send him towards coronavirus patients, he goes home, because he's not risking his life for money, and he's noticing that there's a trend of supervisors putting black staff there purposefully and letting white staff go to the more general wards, take care of flus, broken arms, safer things.
And then that just adds to what you said before of NHS workers dying at higher rates than their white counterparts in the pandemic that we're still in. But Maya Neriman, Sorry, I'm really bad with names, clearly. So she wrote in a journal of nursing in 2019 that the assessment of pain scales can be cultural dependent because cultural backgrounds can also prevent people from even reporting the pain and discomfort appropriately. Some cultures are believed to be more stoic than others, and it's an inherent design bias. So I think that I feel like in regards to tolerance of pain and what has been taught, I think that the cultural background within Black people are to always like firm things, to never like speak out when they are in pain or go to hospitals themselves because they are scared to, because they've just always been taught to like carry on. And I feel like that also that cultural understanding also needs to be tackled in regards to Black people being able to like speak up and not to tolerate pain so that they can get help when they need it. And the other argument would be when they get to hospital to get the help, will people actually listen? But I feel like we have to go to the hospital first.
Yeah, that's what I was literally going to go on to. Like, I think there is an issue in the Afro-Caribbean community where, you know, we won't go to the hospital or we won't seek help unless our leg is falling off. Like, my mum is that woman. But there is also an issue, I think it's historical context. Like, some things are just ingrained in us. The historical relationship between Black people and doctors and that type of institution is mad. Like, literally, it was only in the last 100 years some of the Black people were going to the doctors, and the next thing you know, they didn't have some of their organs. It's not a conspiracy, it's in the history books, not the ones that they're teaching you in British schools though. But I think that's an issue. Like, Black people have this inherent distrust for the medical institution sometimes, and then even when you might think, oh my gosh, no, it's actually getting serious, let me go to the doctors, let me seek help, then they'll turn and look at you and they'll be like, maybe not. Like, I can count countless times where I've been to the doctors and they've just not taken me seriously. And my mum has tried to like ingrain in me more, like, when you really think there's an issue, you need to push it, because you never know when that issue could become a problem just because they wanted to like dismiss you. Like, I've had it so many times, and I know that my friends, at least like other Black women that I'm friends with, have shared the same experiences. It's not just in our heads.
You'll find yourself almost trying to like sell the problem to the doctor, because sometimes you might feel like the doctors won't take you seriously, and it's a cultural factor in one of the reasons why Black people especially are sometimes scared of like going to the GP.
Man, you know, I find it so true what you just said there, because right now I want to expose Palumi. You know, this guy goes to the dentist every 5 years.
Huh? Palumi? Are you scared of the
No.
dentist?
No, I'm not scared of the dentist. Thank God. First of all, thank God. Like, I don't really need to go to the dentist because,
No,
like,
but that's the thing.
my teeth is
You don't know.
okay.
That's how also Black people are. We think we don't need to.
No, what I'm saying
There's
is,
nothing
what I'm saying is, my teeth are good.
But see, Palumi, that's our point exactly. What dental qualifications do you have to come to that conclusion by yourself?
I will go to the dentist more often.
To be fair to you, Palumi, I've not been to the dentist in like 4 years.
What?
So you're not. Yo, if my teeth hurt, I go dentist. That's how I was raised.
No.
And then moving on to like just the Black community in general, I've seen like lots of Black people around me, lots of Black males around me, just like start going to the gym and start like improving their health and start like to get fit and to get better. Because I feel like a problem in the Black community that can be seen is that people have like more diabetes, or like they don't eat right, and they're not as healthy as their white counterpart.
It's not just about the care that you receive outside the hospital, it's also about what we need to do as a community to like take care of ourselves to remain healthy. For example, like, it's a fact that some conditions like diabetes and hypertension, they are more prevalent, as in a Black person's more predisposed to having them, if you get what I mean. I'm not saying that they're going to have them, but genetically they're more predisposed, so we need to take better care of our health and stuff. And I feel like it's only recently there's been a shift in the mindset of like, let's try and be more healthy. And
honestly, I agree with that, because if you look at these traditional foods, oil and salt is the main ingredient, and that leads to high cholesterol. And you know, I'm very glad you brought that up, Palimi, because according to a study I read, diabetes is 60% more common in black people than white people. And high blood pressure at early age is something like 40% more common in black people than white people. And, these are illnesses that come as a result of your lifestyle as the major factor, And I don't know, I feel like the health is wealth movement is something that white people have adopted more than black.
Yeah, it's like veganism.
Yeah.
We're like, that white shit.
But I feel like you only do what you know. It's like the doctors getting taught in the universities. Like, they only know to, like, treat white people, and black people only know to eat these, like, cultural foods and only know to do these things. So I think it's more about attacking, like, institutions rather than people themselves. Go on, Shai.
Yeah, I was just going to say, Akala said it once. He was like, why are we still, as black people, eating the things that we ate on plantations, basically? Because a lot of our culture, especially for like Caribbeans, a lot of our cultural, and African-Americans especially, a lot of our cultural food comes straight from the plantation. It's like the food that you were eating then was literally like the scraps, stuff to just keep you alive, not to, nourish you or keep you healthy necessarily. So it's like, why are we still eating that? I think that definitely, when we're talking about food, that is the historical context then why, we are eating what we are eating, and it's causing the problems that it is creating for us.
Exercise needs to be more encouraged and promoted. Because the problem is, exactly, look at these reactions. You just mentioned the word exercise and people are already leaving the room. We might even have lost some listeners after that one, but it had to be said.
I don't like it.
Yeah, I know it pushes you out your comfort zone, but look, these are the little kind of different. Exercise doesn't even have to be you do a marathon every day. You can just walk for an hour.
Yeah, I've been walking.
Put a podcast in the ears, maybe listen to a nice crisis talk series, and then go walk around the block. Like, it's not. I'm not saying you need to all of a sudden become some Cristiano Ronaldo fitness guru, but I don't know. I think a lot of it comes. A lot of these kind of things come back to this fat shaming concepts.
You love this. I'm sick of it.
The second anyone mentions anything about people's health, and it's like, you're touching certain levels of weight, which is not unhealthy. Oh, how rude! Oh my word, you're such a dickhead! Oh my word! It's like I know some people are generally just dickheads about it, but some people are generally saying it out of pure concern for the person.
Yeah, but I think though, what about like Lizzo, for example? People are always fat shaming her. Sis is healthy. Sis is doing acrobatics on the stage. That is not a fat girl. I could not do that. I would be like, do you know what I mean? Your weight doesn't necessarily correlate with your health. I feel like a lot of people just see bigger. Because me, my health, I'm a size 8. My health. Let's not talk about it.
You need to get to doing them steps.
Maybe next week.
Like, weight doesn't correlate directly with health, but there is definitely some kind of relation. Like, I'm not trying to, if I speak, I'm in danger, but I'm not trying to call anybody out, but like, there is definitely a movement towards, like, people are definitely more accepting of much, much, much larger sizes, which I'm happy for, but at the same time, you have to realize, like, from a health perspective, there are definitely some dangers associated with being that overweight or that weight.
It's that simple. Obesity kills more people than smoking.
I think it also goes back to what Shai was saying about, like, and what Akala said about, like, why we still eat and things that we ate in the plantation. If we still have a slavery mentality, and that is indicative with the relationship you have with your food, of course you're not going to be healthy. Of course you're not going to be eating healthily and knowing what to eat and what not to eat. So I feel like we have to. It's about changing a mentality that was enforced upon us, upon our ancestors, and is still prevalent in this generation. We have to change that mentality and understand that we need to eat better and we need to exercise more. I think it's about finding new cultural foods to eat. Like, we can change in ways that will make ourselves better.
Have a balance, everything in moderation. I'm still gonna fry my plantain tomorrow.
It's all about a balance. It's like, we can still have some of the things that our ancestors ate. Like, I'm still gonna enjoy my Ghanaian jollof rice, the best jollof rice.
Yeah.
But
you're Ghanaian.
Yeah.
Olivia's like, That's the better jollof rice.
We'll have a word after the podcast.
But yeah, it's all about having things in balance.
Yeah. But and I also want to make it clear about what I said earlier about people, if you do my exercise and you are healthier, and therefore you might not need to go to the hospitals themselves. Let me just add on to that. If you're just because you're more healthier and you might not need to go to hospital, it doesn't mean that when you do go to hospital, people still treat you less than or not listen to you, because that's still the problem with the NHS, for example. That's still the problem with the institutions. People still need to listen to Black people when they say that they're in pain, just like they listen to white people when they say they're in pain. So I just wanted to make that clear that that we should, when it comes to us seeking help and us not getting help, it's about the institutions rather than the people ourselves. And it also shows how the different institutions impact each other. So the education institution of universities only teaching medicine students about white people impacts the institution of the hospitals, but like they're both institutions, impacts the institution of hospitals when it comes to doctors not treating Black people, because the doctors themselves that have been taught from the institution of universities don't know how to treat Black people. Preach. So that's institutional racism right then and there.
It's pervasive.
And it's like, but it's the world that
but
we live in.
People don't want to have that conversation. They don't want to talk about it.
Don't talk about
that. One thing I wanted to ask from Chris, just to have something like, let's not just talk about it, let's think about the solutions. What are some of the solutions as a medical student you think?
I think one of the solutions that we need to have is more Black representation at the top, first and foremost, because I'm not trying to side with anyone, but it's quite hard to make a curriculum when there's no, I'm not saying that there is or there isn't, but when there's no Black person in the board, when there's no Black person in the meeting. Like, so I remember, I think, Matt Hancock, the other day on BBC, he was questioned, are there any Black people in the cabinet, in the Tory cabinet? And I was like, basically, he couldn't say no, but the fact of the matter is there isn't. There's no voice for Black people at a higher up position. So I think first and foremost, we need to try and get more Black people into those positions so that more conversations can be had. Secondly, I think we as the youth and this new young generation needs to keep on promoting, just keep on having discussions, because it's only through discussions and people listening is awareness raised, kind of. Yeah, and then afterwards, and then most importantly, education needs to involve basically Black people. It feels so weird to say healthcare workers need to be taught about Black people. It feels weird to say because I think it's pretty obvious, but it's not happening right now. So that needs to happen as well.
Exactly. And just to go to your point, Chris, Diane Abbott.
Diane Abbott. I was Abbott. Like, who? Sis who?
Diane Abbott. Yeah. Diane Abbott she's a Black woman, and she's the only Black woman in a high position in the Labour cabinet, and there's only one of her. And then in 2003, Chairman of the Commission of Racial Equality, Trevor Phillips, said that the NHS was a prime example of snow capping, where the organisational pyramid is white at the top and Black at the bottom. So it affects both NHS patients and the staff as well. Sorry, go on, Chris.
I was going to say, even in hospitals, you see, I don't know the statistics, I forgot the exact figures, but you see there are more white consultants in comparison to Black or other people of colour. And you can literally see it. I'm on placement, or pre-corona, I was on placement in the hospital, and every time I went in, I would literally be the only Black person, the only Black medical student, the only Black healthcare professional. You wouldn't see any other Black consultants or Black nurses. I can literally count on one hand how many times I've seen someone of colour working as a healthcare professional. So there needs to be more inclusivity as well.
I feel like today we've had a very good discussion, and I think we've brought up different ideas, different perspectives in regards to Black people and the NHS specifically. Any last thought?
I just want to ask this one question. Yeah, what's the
Mhm.
safest way to have sex and avoid STDs? Not having sex. And the point I'm saying when I say that
Who
is,
sent you? Okay.
Well,
just
we
He
went
just
from
360.
PG-13 to... Okay,
just
carry on, William.
completely. My point is, if we're doing the best we can to keep ourselves out of hospitals, we keep ourselves healthy, we live in healthy lifestyles, eating vitamins and stuff like that, then we'll see the amount of black people dying from really avoidable situations will reduce as well.
Yeah.
And
But
if
still,
the
institution
I'm saying
change.
the institution,
top people...
Yeah.
as well here.
No, we know.
Yeah, no,
Just
yeah.
NHS, sort it out.
And the universities as well, teach
Sort
people,
it out.
But yes, thank you so much, Chris, for joining us in this episode.
Yeah.
And I can't wait for you to be a doctor. When the NHS gets privatized, just remember me, Shai,
Let's
and
not
William.
talk about it.
Just remember us, and just remember us. Yeah.
Chris will send you that
If
bill.
you have any
30%
midwives,
black he'll still send you that bill. Don't get twisted.
I just want to have my
there we
kids
go.
and not get in debt. I just
Home
home birth who Epidural.
Yeah, make sure you guys like, comment, and subscribe and share. And we'll see you next time for Crisis Talk.